Hi, this is Junaid, NeuroCritical Care Stroke and Epilepsy Specialist. Today we're going to talk about digital health and neurology, opportunities and challenges, especially in countries like Pakistan, India, Bangladesh, where resource limitation can actually be an opportunity, and what would be the significant challenge given the lack of data governance, overall regulation, environment, etc. And more importantly, I want to talk about what is the role of Pakistan Society of Neurology in expanding that level of opportunity to help both themselves as physicians, but also society at large. So again, I'm very grateful to be speaking at Pakistan Society of Neurology annual meeting in March 2022. For those who are watching this on YouTube, you're going to see a little bit of Urdu and other languages mixed up. So don't get terrified about it. It's just a little different language, to be honest with you. But I wanted to make sure that the Pakistani audience stays very engaged. Look, I do work for a telemedicine company here in the US, which is We1 Health, which is a large telemedicine company. We have different, arms, etc. And I'm independently looking at, digital education in digital healthcare. As a matter of fact, this is all about making sure that physicians, patients, societies understand the significant role of digital health transformation moving forward. And this is where it brings us to, right? We are already living at a significant logarithmic change. That means that at the power of 10, we have been moving forward. That was before the digital health revolution, before the artificial intelligence revolution. The change itself has changed. The pace of change has never been faster previously as compared to today, and will never be as slow as it is today. It is only going to be faster. We have been seeing an explosion of knowledge every 73 days. Medical knowledge is actually doubled, but now it is becoming an extremely different issue. If YouTube changes its algorithm, it affects 3 billion people. Facebook, 4 billion people. TikTok, 3 billion people. It is ridiculous. With a flip of a switch, billions of people are affected. We're not in a logarithmic change anymore. We're in an algorithmic change anymore. And this level of change is hugely impactful for billions, not millions of people. Look, the pandemic changed everything. We were already going through a digital shift, right? There's no question about that, right? I mean, right now, maids and drivers have smartphones. The issue was not that. But the pandemic is that it lit up the fire under the belly of digital transformation. The things that e-commerce would have achieved in 10 years got achieved in 8 weeks. Telemedicine would have achieved in decade got achieved in 15 days. Remote learning got completely revamped, and now is probably considered the mainstream of learning, especially in higher education. Online entertainment was already there, Netflix, Amazon Prime, etc. But more and more companies, Paramount Plus, Disney Plus, all of them got into the game because they all understood the future is online, the future is digital. Now, it is all about data. At the end of the day, data. It is not the oil anymore, right? It's not ExxonMobil in 1990s, which was the most valuable company. The most valuable companies are Microsoft, Apple, Google. As a matter of fact, Tesla is not a car company. It's a data company, and that's why it is actually valued as a data company, as an energy company, not actually as a car company. It doesn't make any sense that it's actually more better than Toyota and GM combined. Why is it there? Because it has the data. And healthcare has the most amount of data. As a matter of fact, there are estimates that about 1/3 of all data is created in healthcare. And more importantly, it is not just the dimensions of the healthcare data that is concerning. Like we have disease data, clearly, right? Microbiomics, radiomics, metabolomics, but also health data, activity data, ECG data, video camera data, etc., etc. Then we have claims data, which again, it's not more so as matured in Pakistan as far as insurance company claims are concerned, but there is clearly a movement towards it. And then finally, of course, clinical trials, registries, biobanks, etc. So healthcare has a massive amount of data that it can churn and produce results. More importantly, it is constantly changing. I mean, my metabolomics is not when I was 20 years old, clearly, right? I mean, you can see some white hair over here, right? There's clearly, changes that happens, and those changes over time are also important to notate. So things in healthcare are also constantly evolving as compared to everything else. And not that in other industry is not evolving. The dimensionality of it with the essence of time itself makes it more more appealing in terms of data gathering, data aggregators, etc., etc. Now, not only that, now we are improving the amount of data that is going to come, right? Literally, there are more and more devices being invented, created, mass marketed to create more and more data. Wearables in terms of smart glasses, smart contacts, smart clothes even are coming up to actually measure more and more of your healthcare data. And that measure, that quantification needs to be actually done. Like, we have to process that amount of data. And more importantly, this is becoming cheaper and cheaper. Now, this is why Wise actually is a smartwatch maker, which actually created a fantastic watch. I have it, personally use it for $20. Are you kidding me? For $20, they are creating a smartwatch that is very usable, which has an accelerometer, it has a pulse oximeter, it has a, even it doesn't have an EKG yet, but the next version is going to have EKG in it. The cost is reducing significantly in terms of creating these devices and having that mass adoption, because the cost is now able to be reached to masses. And this is all bringing in the convergence, right? I mean, the convergence is basically that we have mobile technologies, right? Virtual care is there. Then we have intelligent reality that is coming in. We're going to talk about that in a minute. And then we have, 5G becoming more and more accessible. We have digital therapeutics, I'm going to talk about that more. Genomics that is more accessible because it is cheaper. As a matter of fact, we are actually creating more and more 3D artifacts in terms of medicine. We regularly use 3D skulls when we do craniectomies. So this is definitely changing the scape in itself, and everything is definitely going through that is creating data is going to go to artificial intelligence, because there is no way that we have to go move that data continuum forward. It has to go from information to data to knowledge to wisdom, which is applied knowledge, so that we can actually do something about that. That's the key thing. Do something about that. The point was not to get data or aggregate data and sit on it. The point was we are able to meaningfully apply it. We can meaningfully get wisdom out of it. And that's where we're going to talk more about in terms of that. And these are all the list of buzzwords, by the way, in digital health. If you want to copy paste them, that's great. It is fantastic, right? You can have mobile technologies, etc., computer vision, predictive analytics, blah, blah, blah. So the key thing understanding is that no matter what you do, you need artificial intelligence at the heart of it, period. You will not be able to crunch those numbers. You will not be able to operationalize it in a way that you want to create wisdom until and unless you have some algorithms. And again, I've talked about it before, follow my YouTube channel. We'll talk about it more, that how it is it is getting extremely easier to have artificial intelligence studies done because of the Googles and Amazons and everything. So what is truly digital health? Digital health is basically intersection of healthcare and digital, clearly, and it could be in hardware, software, or devices or services, right? It doesn't need to be just software. It is actually an amalgamation, a convergence of all these things. What benefit does it bring? Well, the key issue over here is that everything is digitized, so there is low or no marginal cost in copy pasting it, right? If anything is digital, if you copy paste it, it's just easier, faster. So it's digitized. It's demonetized, clearly, right? I mean, if you have to scale it up, it's much easier, faster, and better as compared to scaling up a large building of billions of dollars. It's much easier to scale up a virtual clinic as compared to a physical clinic. No questions asked. Dematerialized, clearly, more and more. And then given that it is globally sourced, even if you need materials, it is becoming cheaper and cheaper to get, for example, material for devices. Unfortunately, there are double-edged sword in terms of decentralized, right? I mean, first it's beautiful, it could be global in nature, but then again it leads to deregulation as well, which is again a problem. And then unfortunately it is quite deceptive. It is the Kodak moment, right? Everyone used to have Kodak cameras. Remember those plain films where you then used to take pictures, then go and develop, and then everything. It vanished. It is so deceptive that you will not believe. People do not even understand what plain films were. If I told my 5-year-old, hey, this is how we used to take pictures, she would not even understand what that means. So it is extremely, extremely deceptive and disruptive. And of course, it has a scale of exponential growth that nobody does. what does it truly bring to the patient and for you? Is it improves outcomes by decreasing costs, clearly, as I talked about cost and everything. It can has a potential to improve patient engagement. I mean, people are engaging with their cell phones, with TikTok, YouTube, and more, and if you can engage them on the same platform, on the same devices, and show them that there's value in it, you can improve patient engagement. And of course, in some places, you can improve provider satisfaction too, because it can decrease the latency of care. It can improve the data gathering process, automate quite a few things within the care touch points, and this way it could be easier for you to actually take care of the same patient. Participatory, predictive in nature, personalized care, these are all the 4 P's of digital health that we all talk about. Again, before I get into what digital health is, we have to understand what digital transformation really means. We have paper chart, and if you scan them, that becomes a PDF. This thing is called digitization. That PDF then has an OCR, like you can read up and then, turn it into something, or make sure that, these are values that can be stored on a database. It is digitalization. But digital transformation is when you have new core competencies, when you have something that is brand new in terms of experience, in terms of features. That is what digital transformation is. So here's the example of map, right? I mean, a map can be turned into a PDF. So what? You have pagination. Then you can have, point-to-point direction. But enabling that map technology to deliver food, to deliver taxis, to deliver care, that is true digital transformation. So digital health is going through that transformation. We are actually stuck at digitalization. We are moving fast towards digital transformation of healthcare. And as I said, artificial intelligence is also a process. It is going to do exactly like software as a service stack is. I call it artificial intelligence as a service. You have a stack for computer vision, for neuroradiology. You just look at CAT scans. Another will be for MRI. Another will be for TCDs. Another will be for that. Then you will have biosignal processing, EEG, AMG processing, etc. Then you will have natural language processing for charts, etc. All of these will be developed in different stacks, all different services solving small problems at a time. Once they are mature enough, they're going to start converging into an ecosystem, and then that ecosystem is going to bring true value. And that's where the digital transformation will start bringing true benefits for humanity. Within the process, unfortunately, it's going to be a very bumpy ride. And that's, again, I want to make sure that you understand that. What is the end goal here? The end goal is basically virtual hospital at home. We are going to move forward in with remote patient monitoring, virtual care, digitization, that we can have ventilators delivered at home. Lab is going to come and take it to home. We're going to have we have portable MRIs, for God's sakes. By the way, Khan Siddiqui, he's a Pakistani who actually developed Hyperfine. He's the CMO. I mean, he didn't develop, but I mean, he's part of that company which went public. So we are looking at portable MRIs that can plug into a regular socket where your coffee maker does and can do MRIs. Can you believe that? So we are actually moving forward the needle of taking care of these patients at home, even sick ones as well. This is why the digital funding is going high. I mean, it is fascinating, the year increase in funding. Actually, it went up by 79% only in 2021. Wall Street, venture capitals are hunting people with talent so that they can back that up, because they understand that it is going to be an $8 trillion industry. And why do you think Amazon Care is developed? Why do you think Walmart Health is developed? Why do you think Microsoft and Google have health plans? Why do you think Apple has actually said that our most important contribution to humanity will be in health? It's $8 trillion, baby. It's nothing else. So it's a little different. I mean, we always see financial funding much more higher as compared to digital funding, but it is catching up. It's not bad. I mean, there used to be a huge chasm between healthcare funding and financial funding. I mean, in terms of blockchain and NFTs, etc. But we are actually seeing that finally digital health is seeing its day in the light. So what is the current status in terms of, as I talked about, that we are talking about digitalization? The greatest opportunity in terms of Pakistan, in terms of digitalization, is virtual clinical trials. What do I mean by that? All of the digital pharmaceutical companies, device companies, are looking at data. They want to validate their particular device. They want to make new drugs. Give me an example. For example, there's a new seizure medication that comes in. What is the endpoint generally? Generally the endpoint is 50% reduction in seizure frequency, right? How do you measure it? I mean, it's at the end of the day, patient reported, right? I mean, nobody's hooking them up on EEG for days and days and days. If the patient reporting is going to be done over a digital application, then that can turn into a global, decentralized, virtual clinical trial. As a matter of fact, you can actually have even patient visits virtually done, recorded, and then analyzed later. So that's just an amazing way in which Pakistan and especially neurologists can contribute. We are looking at newer and newer devices. I mean, this is an FDA approved therapy right now. This is not the future. I'm not talking about tomorrow. I'm not talking about, moonshots. I'm literally talking about today, the current status. We are looking at a virtual reality system that is FDA approved for pain management. That is going to be reimbursed. Who's going to teach me all this? Like, who's going to teach me the indication of it, the contraindication of it, the side effects of it? Who's going to tell me like how many milligrams that we used to use in drugs, how many minutes of virtual reality do we need? These are things that we need to learn as physicians going forward as well. So we need to understand that virtual clinical trials is the greatest opportunity, but more importantly, these are going to be an important part of your practice. And if you're not going to learn it, then then you have to, there's no other way around it, unless you learn it. And then again, these are newer devices that are coming in. Embrace 2, people may have known about it. This is a seizure detection device, again, FDA approved for seizures. So more and more, we are looking at digitalization of healthcare. But here's the problem. The problem is that this is going to become the new digital snake oil. Look, medicine has a huge, long history of digital snake oil. I mean, snake oil in general. And now we're looking at a digital age in snake oil. And especially in the beginning, more and more people are actually taking advantage of it. Either it's a grab for data, it is a grab for engagement, it is a grab for revenue so that they can go to a VC and sell it, the company for a higher price and just move on and disappear. Be very extremely careful. Especially they're coming to low-income countries like Pakistan, and the reason they're doing it is that they want diversity of data. Clearly that is important, but more importantly, they're just trying to get that data and move on and not having any societal benefits. And that is the key thing that I want your Pakistan Society of Neurology to pay attention to. As a matter of fact, people come to me all the time and they say, hey, if you have some neurology expertise, you have some AI expertise, why don't you join our team? We can put you as a medical advisor, and then I can put it on my pitch deck. Hey, we have an artificial intelligence arm. And clearly, when you have that in the pitch deck, the company that was supposed to be $5 million in terms of post-money valuation now is going to be $10 million. It's literally the stupid pitch deck. They don't really have any artificial intelligence, believe it or not. They are just pitching it. Oh, we'll develop it. Oh, we'll do this. Oh, we'll do that. The industry is becoming a kind of nuisance at this point in time. And especially in this day and age, you have to be careful who's pitching what and really understand where exactly it is being used. As a matter of fact, I do consulting work for even VC funds, and they call me and ask me like, hey, what do you think about this? And I said, well, great, fantastic pitch deck on a PowerPoint. Where is the outcome? Where is the patient benefit? Where is the problem itself, for God's sake, that this thing is solving? Because I don't see a problem that needs to be solved here. So there are things that are happening in this situation that you have to be very, very careful about. And we're seeing this truly happening in Pakistan. I mean, Punjab government is actually creating a digital health infrastructure, which is fantastic, which is great. We should support it. However, India is doing through a different way, right? India has a new open platform for national digital health ecosystem. And to be honest with you, this is where Pakistan should go. PSN should say to the government that this is not something that's going to be restricted to provincial level. It should be a federal level thing. So that's one thing that you should be actually doing right away, is that making sure that we have an infrastructure, because it's digital, right? I mean, it is going to cross boundaries, for God's sakes. I mean, it's not like the computer bits and bytes can see where the maps you end. So I don't understand why there's fragmentation that is going on. Definitely a good step, but definitely should be more federalized. And what is the role of societies like PSN? Look, it is extremely important that you have an evaluation pathway for devices and applications and certify them and authenticate them because they are meaningfully used for the patient. And then there's level of data privacy. I'm going to come to that in a minute. So what do I mean by meaningful use, right? For example, if you're going to have a device, is it really going to help the patient or not? If it's not going to help the patient, why the hell are we making the patient spend the money because, somebody's getting a cut out of it or something else? So and there's nothing wrong with it. You should get paid for it. PSN should get paid for it. They should form a committee and committee members should get paid for it. Why JCO actually certifies hospitals if they are good enough or not, and then who they get money from? The hospital itself. So why not? Why can't we do that in Pakistan? And we should do that in Pakistan. I mean, you should have a proper, transparent way of why it happened, a complete report generated, whatever. But at the end of the day, you should have that, especially in neurology and neurosciences, because there's a lot of digital snake oil going on. Look, data privacy is an odd subject, right? I mean, I was born in Pakistan. We have 6 brothers and sisters. We lived in a 2-bedroom apartment one time and 15-bedroom bungalow at one time. But when you're I never understood what the frickin' privacy is. I mean, 6 बहन भाइयों के साथ दो कमरों के मकान में रहना है, ये क्या privacy की bullshit है? मतलब मेरी तो समझ में ही नहीं आता. Lekin, I mean, clearly it is an issue that is going on over here. We need to make sure that, data privacy is there. Why? Here's the issue. If my genomic data is done and it is shared, does not only apply to me. It applies to my progeny, for God's sakes. जो आगे 10 generations आएंगी उनको genetic issues हैं वो भी होंगे और मेरी extended family को भी applications होंगी, right? मेरे बहन भाइयों को नहीं पता होगा. We need to make sure that these data privacy standards are there while we are producing that infrastructure. सिंपल सा लॉ है भाई कि इंश्योरेंस कंपनीज के पास जीनोमिक डेटा नहीं जाएगा, ख़त्म कहानी. यूरोप में है, ऑस्ट्रेलिया में है, यूएस में इट्स गार्बेज बिकॉज वी स्टिल हैव रियली वेरी बैड लीगल स्ट्रक्चर टुवर्ड्स डेटा प्राइवेसी, बट वी शुड फॉलो व्हाट यूके एंड ऑस्ट्रेलिया इज डूइंग एटलीस्ट इन पाकिस्तान. दूसरा ये कि फिजिशियंस नीड टू बी स्टेक होल्डर्स. लेट मी गिव यू 2 एग्जांपल्स. लैब ग्रेड एक्सेलरोमीटर दैट कैन डिटेक्ट ट्रेमर्स सिर्फ देखने के लिए 30 डे बैटरी लाइफ की डिवाइस जो है वो $4 की मिलती है. वो मास प्रोडक्शन के साथ करेंगे एंड एवरीथिंग दैट गोना बी बेसिकली $1. यू कैन रन अ क्लिनिकल ट्रायल with that device, clinically validate that and then send it out. Physicians need to start doing that. They need to be stakeholders in digital healthcare rather than just consumers of it. More importantly, physicians in Pakistan need to very importantly take this new opportunity of virtual clinical trials. Very important. And lastly, you should have reimbursement. देखो मैंने application बनाई, I just stopped it. But the reason I stopped it is because I did not have a pathway to actually pay the physicians. I'm working on it. Once I have that, then I'll do that. But 30% platform charge है. That's understandable. That's industry standard. 30% physician को मिलने चाहिए. भाई तुमने जाके पेशेंट को समझाना है, उसको बताना है, इसको पास फॉलो अप करना है, इसके बाद इसकी डेटा को देखना है, सारी चीज़ें करनी है, उसको पैसे मिलने चाहिए. भाई क्या मजाक लगाया हुआ. You should get paid for it. And therefore, you should have that pathway built in for you that you are also getting reimbursed in this digital health technology. सारा का सारा जो है वो पीछे नहीं चला जाए. It's extremely important that you also have those pathways, possibly written in the legislation, and if not, at least as a group of physicians, you can come together and say, भाई ये तो ऐसा नहीं चलेगा. या तो सबको मिलेंगे, सब मिल के बैठ के खाएंगे, या फिर कोई बात नहीं. And that's extremely important. They have the money, they should share it. आखिरी चीज़ यही चीज़ आ जाती है सोसाइटी लेवल पे. सोसाइटी लेवल पे क्या फ़ायदा होगा भाई? 3 चीज़ें हो सकती है. एक तो डिजिटल एजुकेशन करा रहे हैं, वकार इज मेकिंग वीडियोज़, आई एम मेकिंग वीडियोज़, we should all come together somehow to actually make sure that these are patient education videos are there, health education in digital health can be made. दूसरा ये है कि भाई they can create a data pipeline, right? भाई data pipeline भी है कि भाई these are 5-6 hospitals, we are working together, we can come back and then do a simple study, CT brain artificial intelligence to get hemorrhage detection. कुछ भी नहीं है. I mean, I can get this done in literally 15 days if I have 20,000 scans. Literally. कोई मजाक ही नहीं है. Try to do that. Try to get those things engaged. And we have such a huge potential in Pakistan. We have best bioengineering students. We have a lot of artificial engineering students as well. And of course, पूरी army की army बैठी है medical students की और physicians की that can do that. They should do that. More importantly, अब मसला सारा ये है कि सोसाइटी कहाँ आती है. देखो मैं अगर हूँ फॉर एग्जांपल बिग फार्मा कंपनी और मैं आती हूँ तुम्हारे पास कि भाई मेरे पास ये टेस्ट कराना है और डिजिटल ऐप भी देता हूँ मैं, ये भी है. अब मैं क्या करूँगा? Well, I have to go to every city, talk to individual doctors, make individual contracts, then follow up on them, make sure they're representing enough, then pay them. इतना ड्रामा कौन करेगा? छोड़ो यार पाकिस्तान को, चलते हैं कहीं और. कहाँ? Argentina is a good place. Colombia is a good place. Cambodia is a good place. They're all developing this. Vietnam is getting into it. Philippines is doing fantastic work in it. What PSN can do is have a group of physicians together. भाई ये 60 trained like बंदे हैं, ये 20 बंदे स्ट्रोक के हैं, ये 60 बंदे मूवमेंट डिसऑर्डर के हैं, ये 70 बंदे MS स्पेशलिस्ट हैं. ये रहे. अब आपको नई ड्रग लानी है, हमने सबको ट्रेन किया हुआ है पहले से, सबके प्लेटफॉर्म्स बने हुए हैं, एक कॉन्ट्रैक्ट होगा, ज़्यादा ड्रामा नहीं होगा, हम वी विल टेक केयर ऑफ रीइंबर्समेंट थ्रू दिस. ये ग्रुप अप्रोच जब होगी तो मैं जब आऊँगा मैं बोलूँगा अरे ये तो बड़ा आसान हो गया, मेरे पास 60 फिजिशियंस भी हैं, 60,000 पेशेंट्स एक्सपेक्टेड भी हैं, और फिर ये जो है PSN इज़ गोना टेक केयर ऑफ इट एंड इट इज़ एक्चुअली एन रिलायबल ऑर्गेनाइजेशन. पहला काम उनसे करा लो, थोड़े से पैसे भी बनवा लो, उसके बाद अपनी डिवाइस बना के अपने चक्कर करना. अगर तुम मिल के काम किया देन यू कैन मेक अ बिग डिफरेंस. इफ़ यू आर गोना बिकम एक दूसरे से कम्पीट किया तो गए. Who's gonna win? I mean, India, Philippines, Vietnam, they're gonna win. Unless and until you come on together and say कि भाई ये सबको पैसे मिलने चाहिए, ये proper process होगा, these are the experts we're gonna rely on, these are people that we can follow through, then we can create a significant impact, both economically and financially, both for patients and physicians. Physicians को भी पैसे मिलने चाहिए, and more importantly then the societal benefits come later as well. So that is the key thing in terms of that. Authenticate, collaborate. Collaborate, collaborate, collaborate. One way to collaborate is actually helping me. I'm creating this neurology pocketbook. And the whole lecture that is done is actually published in a book chapter as Digital Health and Introduction. और ये पूरा का पूरा open access है. Like anyone can go in, copy paste it without any issues. As a matter of fact, I'm trying to make these images that I use, which is with a graphic designer and everything, can have like able to edit, and you can actually use it on your own presentations, pitch decks, whatever you need to do. What I need is you can contribute in terms of making sure that people know about this resource. Also, if you're interested in mentoring some students, especially in Pakistan, to actually improve their CVs. As a matter of fact, people who have contributed on it have been able to improve their CVs and have gotten good response on their AIaaS applications for residencies here in neurology. So I'll be very grateful if you can make sure that this resource reaches as many people as possible. Again, very grateful that you call me, and make sure that you follow me on YouTube, LinkedIn, and Twitter, and connect with me for different ideas, possible collaboration. Assalamu alaikum. Jazakallah.
If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.